Letermovir for cytomegalovirus prophylaxis in hematopoietic cell transplantation. Cytomegalovirus is a virus found around the world. It is related to the viruses that cause chickenpox and infection mononucleosis. Between 50% and 80% of adults in the United States have had a cytomegalovirus infection by age 40. Once cytomegalovirus is in a person's body, it stays there for life. Most people with cytomegalovirus don't need treatment. If you have a weak immune system, your doctor may prescribe antiviral medicine. Good hygiene, including proper hand washing, may help prevent infection.
CMV, cytomegalovirus, a virus that infects 50 to 85% of adults in the US by age 40 and is also the virus most frequently transmitted to a child before birth. Persons with symptoms have a mononucleosis-like syndrome with prolonged fever and mild hepatitis. Once a person becomes infected, the virus remains alive and usually dormant within that person's body for life. Recurrent disease rarely occurs unless the person's immune system is suppressed due to therapeutic drugs or disease. CMV infection is therefore a concern because of the risk of infection to the unborn baby, people who work with children, and immunodeficient people such as transplant recipients and those with HIV. CMV is a member of the herpes virus group.
Hematopoietic cell transplantation. Hematopoietic stem cell transplantation is the transplantation of multipotent hematopoietic stem cells. It is a medical procedure in the fields of hematology, most often performed for patients with certain cancers of the blood or bone marrow, such as multiple myeloma or leukemia. In these cases, the recipient's immune system is usually destroyed with radiation or chemotherapy before the transplantation.
Bone marrow is a spongy tissue found in your bones. Inside the marrow of the pelvic bone, hips, ribs, skull, and spine are tiny spaces that contain stem cells. These primitive cells are able to grow into various types of blood cells, including white blood cells called leukocytes, which fight infection, red blood cells or erythrocytes, which carry oxygen, and platelets, which enable the blood to clot and prevent excessive bleeding. White blood cells play an essential role in your immune system. Although there are 5 types of white blood cells, the 2 your bone marrow transplant team will mainly focus on are neutrophils, which account for about 60% of all white blood cells that move through your body, and lymphocytes that account for about 30%.
Letermovir. Letermovir is an antiviral drug that is being developed for the treatment of cytomegalovirus infections. It has been tested in cytomegalovirus infected patients with a lytic system, cell transplants, and may also be useful for other patients with a compromised immune system, such as those with organ transplants or HIV infections. Letermovir is new, highly potent anti-cytomegalovirus agent with a novel mechanism of action targeting the viral terminase subunit PUL56, a component of the terminase complex involved in viral DNA cleavage, a packaging that has no equivalent targeting enzyme in the human body. As such, Letermovir also provides a potential new treatment option for patients infected with cytomegalovirus strains that are resistant to approved antiviral drugs.
In terms of another virus that sometimes brings a lot of questions as to testing, there is one virus called cytomegalovirus. And cytomegalovirus gets its name for what it does to the cells. It actually, under the microscope, makes the cells like giant cells or something. They look very big. And so the name cytomegalovirus. In a simple manner for the lay person, I think it's the model that we all know about chickenpox and measles and German measles, childhood illnesses, is a good example of how most things respond with cytomegalovirus. First of all, the vast majority of the population has been exposed and has had cytomegalovirus. It often will happen in childhood or adolescence, teenage years, early adulthood. It will be exposed through some kind of intimate contact, whether it's a sneeze or a kiss or something else. Sexual activity possibly can do it. It shows itself as an influenza-like syndrome. Fever, you don't feel well, you're not hungry, you're nauseous, you're vomiting, you don't want to get out of bed, you want to sleep, you're dizzy. It looks like a flu.